Hello, my name is Sabin Karki, and I'm a senior biomedical engineering student at Johns Hopkins University and the co-founder of Benegraft. We're a team of 7 biomedical engineering students developing a new tool for the reconstructive surgery space, starting as a design program at Johns Hopkins about 2 years ago. I want to start by posing a question. Imagine that you need to go in for a surgery, but there's a 1 in 4 chance that you'll need a reoperation. Would you still be willing to undergo this procedure? Unfortunately, these reoperation rates are the reality today in reconstructive graft rhinoplasty procedures. There are approximately 200,000 graft rhinoplasties performed every year in the US. These are surgeries in which facial plastic surgeons or ENTs use cartilage taken from the patient or cadavers and shape it into the desired form to prop up or add contour to regions of the nose, either to restore functionality in breathing or for aesthetic changes. Now, nearly 1 in 4 of these procedures require a surgical revision, often at cost to the facility performing it. Why is this? The reason is due to the way that grafts are often shaped. Traditionally, a surgeon will remove a section of cartilage from the patient's septum, rib, or their ear and carve away at the tissue using a manual blade to form the desired shape. Despite rhinoplasties being the most common reconstructive procedure, it requires a really skillful method of carving to achieve a symmetric graft. Furthermore, there's a high risk of the tissue warping after being implanted when carving. Reoperation is extremely costly, painful, and difficult to perform. An alternative method which is attractive to surgeons, however, is the use of diced grafts. Through this method, surgeons use a blade to dice the tissue into 1 millimeter sized pieces, and then use the tissue glue as adhesive before placing the graft into the nose. These grafts don't warp, have a far lower rate of resorption than carved grafts, and are much easier to shape because surgeons can manually mold the grafts like Play-Doh with their hands instead of carving. As a result, the reoperation rate is a much lower 4%. So why don't all surgeons use dice techniques? As we've learned, the primary reason we found is that dicing cartilage is an extremely laborious and effortful process. Meticulously chopping cartilage uniformly can take up to 2 hours in the operating room. It takes an average time of about 45 minutes. Over the past 2 years, our team has worked to develop the Benegraft rapid dicing system, a single-use device which can effortlessly dice cartilage for reconstructive procedures. It's easy to use, powerless, and can fit in the palm of your hand. And as you can see here in the bottom left, our device can chop cartilage to the necessary piece size within 3 minutes, whereas when you're chopping manually, you're still not at an implantable piece size at 25 minutes when dicing by hand. Our device can chop cartilage from all sources in over 90% less time than manual chopping, which reduces operating time, can contribute to improved outcomes, and reduces the risk of complications like warping and resorption that you see with carved cartilage. Here we can see an early prototype of device in action where a piece of cartilage is diced in less than 3 minutes. Now, while there are other cartilage processing tools available on the market, these are focused on crushing cartilage to create flat sheets or slicing it into more carvable sections rather than dicing it. Only our device can reduce the time to create diced grafts, create consistently sized pieces, and doesn't result in cartilage cell death, which occurs when you're crushing cartilage. Existing tools on the market that crush cartilage are the Cottle, Tolsdorf, and the Jost cartilage crusher, which are priced at around the mid 100s to the upper 300s, $400 range. Our device, unlike these reusable tools, is disposable and single use. And we believe that $150 is a highly competitive price point based on a $30 cost to manufacture and sterilize. Our sales strategy is to distribute this device through surgical tool distributors already embedded in the reconstructive surgery space, as this is an ideal method for single-use devices. Our payer mix is split with approximately 70% of graft rhinoplasties being performed in private practices and 30% in a hospital setting, where reimbursement can occur under bundled CPT codes. Since January, our team has filed a provisional patent to protect our cartilage dicing mechanism and our method of preventing tissue from being stuck inside the device. We've submitted our data in a manuscript to the Journal of Medical Devices, which includes the reductions in dicing time we've achieved and the reduced cartilage loss from our device compared to manual dicing by hand. Further, we're also preparing for a second study, which will describe the surgeon experiences using our device to create dorsal onlay grafts. And this data will be submitted to the Journal of Plastic, Reconstructive, and Aesthetic Surgery. As part of our marketing strategy, we'll be presenting this data at a facial plastic surgery conference in the fall. Our device is an easy-to-use tool we feel would be a valuable addition to any rhinoplasty or ENT surgical tool belt. The rapid dicer not only makes graft rhinoplasty procedures faster, but makes it easier than ever before for patients to have better outcomes when they're on the operating table. Our tool easily integrates into the surgical workflow and descales the process for graft creation, which means any member of the surgical team, not just a surgeon, can prepare the diced tissue. With the Benegraft rapid dicing system, reconstructive surgery is faster and better. Thank you for your time, and we look forward to hearing from you.